Hello, WhidbeyHealth providers and physicians. This is Nick Pereira, the Chief of Medicine and Emergency Department Medical Director. And I'm doing a quick update video on how to order sedation and restraints in Expanse. Expanse is a little different than the old Meditech, and there's some idiosyncrasies, so just stick with me here and we'll work through it. I'm going to start with sedation. Ordering any of the following medications will reflex a order for ED sedation, procedural sedation. You need to check both of them. The medications include ketamine, fentanyl, etomidate, propofol, or midazolam. So I'm going to go into this patient here and go into the orders. So for this patient, let's say we're straightening out their arm. We've got a fracture. We're going to order some ketamine and figure out the dose here. Maybe you don't want to use quite that dose. Maybe you want to use 200. You just fix that. And then as you can see here over on the left, there's both a order for chemical restraint. We'll go over that later when we talk about restraints. But then there's these two orders for ED sedation and procedural sedation. You need to check both. One populates the nursing work list and one populates the respiratory therapist work list. So make sure you check both of these boxes over here. And then you're going to submit that and get everything ready, consent the patient, get them ready, give them the ketamine, straighten out their arm. And then when you document on the patient, you're going to make sure to use the procedural sedation template over here. That's under procedures. It's almost, I think, the last one. I take that back. It's sixth, seventh to the last. And you're going to check all the appropriate boxes. You want to make sure you check which ASA class they are. You want to say what med you used. In this case, you used ketamine. We used 200 milligrams IM. I think it was IM or IV. I don't remember. We used one of them. Make sure you get it right. And then make sure you put in their Mallampati classification. You see this little asterisk here. That means that is a required field. And then it's time in sedation. And then you're good. Make sure in this case you would also do the reduction template for their reduction of their broken arm, and that's how you do a sedation. It's pretty easy compared to some of the things we'll talk about. One thing I do want to note is that propofol is a bit of a special case. I'll go back into this chart and order some propofol. The reason propofol is a special case is because it is so short acting that you end up titrating it. You don't know going into the room exactly how much you're going to use. So again, you're going to click both these boxes and you're going to do C-dose instructions, okay? And that allows the nurse to grab a bottle of propofol with kind of a non-specific amount that you're going to give. And then just make sure in that sedation template that you say how much propofol you gave. Best dose or best practice, I think, is to say, you gave 3 aliquots of 50 milligrams for a total of 150. And make sure that the nurse, you're very vocal with the nurse so he or she matches your charting, and you also have to return it to the nurse in that case since propofol needs to be wasted. In this case, the patient is allergic to peanuts, and we don't care. So I'm going to pin that in. All right, so that's basically all there is for sedations. Those are pretty easy. We'll be doing very well on those as far as compliance. So I'm going to jump into restraints. So things to know about restraints. Every application of a restraint needs an order, an assessment, and a face-to-face note, albeit that's not true for nonviolent restraints, okay? A patient in the seclusion room, which in the emergency department is bed 14, if they have the door closed, they also need an order for violent restraints and face-to-face, just like if you're putting them in violent restraints. There's really no difference there. So I'm going to choose a different patient. Let's say this one. Actually, not that one because they're only 1 year old. That makes things harder. Let's say this one. I'm going to sign up for this 20-year-old patient. Okay. Now, let's say this patient is intubated. You want to order nonviolent restraints. Those are pretty easy. Just type in nonviolent. Now you do have to put in the reasons you're putting them in restraints in the order. Okay. And I would say 90% of the time it's because they're intubated. So I would just, frankly, just kind of copy and paste intubated for all these boxes here, just for time's sake. Maybe for this last one, you would put when extubated. And then nonviolent restraint type, we're going to be using soft extremity restraints. And then, what did you try? Well, you could say not attempted because they're intubated. Okay. It reflexes this restraint assessment order, which is very appropriate. And then you're going to submit it. Now, you can see here there's an asterisk, so there's a required field I didn't fill out. Here it is. Well, why didn't we try less restrictive alternatives? Well, because they're intubated. Where are the restraints? Bilateral upper extremities all the time. Make sure that's what's on them. Make sure it matches the nursing documentation. Okay. And why? We're protecting a medically necessary device. Now I can go ahead and pin this in. Now, one thing you'll see, nonviolent restraints have to be renewed every 24 hours. So as we come out to the tracker board here, you can see we've triggered this restraint expire column, and it says 23 hours and 57 minutes is when the next restraint order is necessary. Okay, and again, that's to cue us that in 24 hours, if that patient is still needing nonviolent restraints, they need a new order. They don't need a new face-to-face because they never had a face-to-face because this is nonviolent. Okay, now let's try violent because violent's a little different. So let's go to a new patient, 52 years old. I'll sign up for this patient. And let's first do some chemical restraints. Okay. Any of the following medications will reflex an order for chemical restraints. They include droperidol, lorazepam, haloperidol, ketamine, midazolam, or olanzapine. So I'm going to type in haloperidol here. And you can see, we get this chemical restraint order. We have to click that, okay? And then very similar boxes to what we were just dealing with, but obviously intubated isn't going to be the reason. Psychotic and fighting could be. Not applicable, when not trying to kill me. What medications are you using? Well, we're using Haldol. And what did you try first? Well, maybe you tried to give them some food. Maybe you tried to, treat their pain, what have you. And they're aggressive, so that's what goes in there. Okay, so now you submit that. Now, I'm going to come back out to the tracker board. And one thing you'll notice here is, let me refresh. All right, in theory, right here, it should have said a 4-hour restraint expire thing. That may be broken in the test module here, so we won't worry about that too much. Now, here's the tip and trick here. Okay, it's going to take a few minutes for the nurse to actually give that Haldol. You don't want to do the face-to-face until the Haldol is actually administered. That the face-to-face has to be done within minutes of the restraint application, which is defined in a chemical restraint as being when the medication was administered. If you do the face-to-face before the medicine is administered, it'll be a fallout. It has to be done after the medication is administered, but within 60 minutes. Okay. Chemical restraints are a one-time order and do not need to be renewed, but if you give them any more meds that are used for chemical restraint, the whole process has to be started over again. All right, so let's go into a note here. I'll just walk you through the face-to-face here. Excuse me, I did the wrong type of note here. We're going to cancel this note. Delete, yes. Document. All right, and what's your face-to-face note? You just type in face here, and then you'll get the face-to-face documentation. The date, again, the date and time need to be when you did the document or when you did the evaluation, okay, which should be after the medication is administered, but within 60 minutes. We'll just say they've already received the medication, and it is now 5 p.m. So I'm going to say we'll say 17:49. That works out fine because it's a little late, but it's within 60 minutes. And we did violent chemical with physical hold. And then you're just going to fill in all these boxes. They're non-compliant, they're demanding, they're trying to kill you, etc., and so on and so forth. Once all these are filled in, you can sign that chart. Obviously, spend a little more time on this than I did, but you get the idea. Okay, so that's a chemical restraint. All right, violent restraints. Sign up for this patient, and we're going to go in and do violent restraints. Violent restraints are fairly similar to chemical, with a few minor changes. Violent restraint type, almost always going to be locked extremity, and restraint location, probably almost always going to be all extremities. That said, make sure what you're documenting here matches what the nurse puts in the chart. If the nurse documents, upper extremities only, and you document all extremities, that's a fallout. What least restrictive alternatives did you attempt? Why do they need to be restrained? Meth, psychotic, just the most common reasons here. And also reflexes the restraint assessment here. So you're going to go ahead and type that in. Now, a reminder that violent restraints do need to be renewed as long as the violent restraints are on the patient. And that frequency of renewal dependent on age. If they are adults, it's every 4 hours. If they're between the ages of 9 and 17, it's every 2 hours. And if it's a patient under the age of 9, it's every hour. You need a fresh, that worked. So here we go. We got the restraint expiration 4-hour timer going now on this one. You need a fresh face-to-face with each renewal. I won't show you the face-to-face on this one because it's the same as the other one. Oh, no, I didn't. Yeah, it's the same as the chemical restraint one. And then if orders are discontinued and then if violent restraints are discontinued and reapplied, the whole process starts over. You need a new face-to-face, a new order, etc. Some pitfalls. I already mentioned that the face-to-face for chemical restraints has to be done after the meds are administered, not after the order. And that's a frequent one. So make sure your face-to-face is after the meds are given. Make sure you're always communicating with your nurse. And we've had patients end up in restraints and the physician never knew, which will be an automatic fallout because there will be no order. So if you have an intubated patient, make sure you're talking to the nurse about whether or not they're going to be in nonviolent restraints. And if they are, make sure that order gets put in expeditiously after the restraints go on. You may want to put the renewal time in the comments or set an alarm on your phone. And if you're signing out a patient who's being restrained, make sure during sign out it's very clear when the restraint order needs to be renewed and what actions need to be done. I think that's all I got for you. You know how to reach me if you have any questions, and see you next time.